Dr. Tony Leachon joins us now for more on his views on the President's COVID-19 response and plans for the health sector. Doc Tony, thank you so much for joining us. Balancing lives versus livelihoods and no more lockdowns, according to President Bongbong Marcos's SONA speech. What do you make of this?
Well, I fully agree with the President that the economy is the priority right now. Since the COVID or the Omicron cases right now are manageable at home, and because of prior vaccinations and of course though a low booster rate have actually helped us in terms of decreasing our caseload as well as decreasing our mortalities or death and improving, of course, or decreasing our healthcare utilization rate. And I think this is one important thing. That's why the Advisory Council on Experts have joined hands together with the business sector led by former advisor Joey Concepcion so that we can really prioritize the economy while managing, of course, the health coming from the inputs of the health advocates. So I think this is a welcome, a very comprehensive, detailed report of the healthcare system, and I fully agree with the President on this particular aspect.
What do you make of the President's plan, Doc Tony, to build specialty hospitals in other regions? Lung, heart, kidney, and children's hospitals. He also wants to establish a Center for Disease Control and Prevention and a Vaccine Institute. Are all of these realistic plans?
Okay. Those are very ambitious, but I think that's very visionary of the President. But it would only be accomplished in the midterm or perhaps during the last term or the last year of the President, considering that infrastructures will take a while. But in any healthcare system, the cornerstone of the healthcare system is actually the health human resources. The Philippines is the #1 exporter of nurses in the world. Right now, we have 90,000 active nurses, considering that what we need right now is 300,000 in the year of the pandemic. And then, of course, we need to realize as well that the out-of-pocket expenditure should actually be reduced, considering we have not yet implemented universal healthcare. So we need to consider the health human resources, an efficient delivery of the PhilHealth, not affected by alleged corruption as well as inefficiency. And this will be more important in creating the healthcare infrastructure. In an archipelago setting, for the information of the public, 50% of the doctors are actually in the National Capital Region. 50% of the best hospitals are actually in the National Capital Region. The farther you are from the National Capital Region, the greater is the mortality and morbidity related to diseases as
so
well.
these plans, as you say, Doc Tony, are really very ambitious. Not only that, they're also capital-intensive projects. And where does the government get the money to build all of these great projects that are being laid out by the President?
That's a very good question, because the analysis of Dr. Anthony Fauci in the States is that you need to put the health budget at the top, not military or any other aspect of the government, because you need a lot of funding right now for the health human resources, of course for PhilHealth, and the infrastructure. So you have to put money where your mouth is. And if it is the health is equated to the wealth of the country, then you need to provide the human capital. And it's actually defined as a healthy and educated population.
And Doc, do you think that with the support that the President has politically, we'll be able to get much more of the population vaccinated and boosted, not only once, but twice?
I think it's a clear marching orders for all the legislators and the LGUs. That definitely the booster will be the game changer here. We have only 70 million primary vaccinated, but only 15 million for the booster. The President should be able to do this in the next 100 days. The booster, I mean, so that you can carry out the face-to-face classes, and then open up the economy to more investment. So therefore, it is anchored and hinged on a very good booster program to end the pandemic and shift to an endemic status.
Health reform advocate, Dr. Tony Leachon, thank you so much for your views on the medical aspect of President Marcos Jr.'s SONA. Dr. Tony Leachon.